For 40 years, maybe more, you've seen a line on your pay stub. It's always been there, a small but constant deduction listed right next to Social Security, Medicare tax. You've paid into this system your entire working life. You've held up your end of the bargain. Now, as you approach retirement, it's time for the system to hold up its end. That promise, the one you've been funding for decades, starts with Medicare Part A. It's often called premium-free hospital insurance. But is the promise of free really true? The answer will shock you. Let's cut through all the noise, the confusing government websites, and the endless fine print. I'm going to keep it simple. Medicare Part A is your hospital insurance. That's it. Think of it as the coverage for the building itself and the essential services you receive inside that building when you are formally admitted as an inpatient. It's designed to handle the big, expensive, and often unexpected events in life, not your regular doctor checkups or your prescriptions. It is the foundation of your Medicare coverage, but as you're about to find out, a foundation with some serious cracks. So what do you actually get for all those years of taxes? What does Part A truly cover? It primarily covers 4 things, but listen closely, because each one comes with a critical catch, a detail that can make all the difference. First, and most obviously, Part A covers inpatient hospital stays. This is the core of the coverage. It pays for your semi-private room, your meals, and the general nursing services you receive. It covers the things that make the hospital function. But here's the first shocking detail, the one that blindsides so many people. It does not cover the doctor's fees. Not the surgeon who performs the operation, not the anesthesiologist, not the specialist who comes to check on you. Their bills are completely separate. We'll come back to that terrifying detail later. Just let that sink in for a moment. The hospital room is covered, but the experts working on you inside that room are not. Second, Part A covers skilled nursing facility care. Now, you must pay very close attention to these words. This is not a nursing home. Let me repeat that, because it is one of the most devastating and costly misunderstandings in all of American healthcare. A nursing home, the place where someone might live for months or years for custodial care, is not what this covers. Part A covers a short-term stay in a skilled nursing facility after a qualifying hospital stay. Its purpose is rehabilitation. You were in the hospital for a hip replacement, and now you need physical therapy to learn to walk again. You had a serious illness and need IV medications and skilled wound care. It is for recovery, not for long-term living. The key word is skilled. If you don't need skilled therapy or nursing services every day, Medicare will not pay. Third, Part A covers hospice care. This is end-of-life care. If a doctor certifies that you have a terminal illness and are expected to have 6 months or less to live, Part A will cover care focused on comfort and pain management rather than curing the illness. This care is most often provided right in your own home, and it covers everything from nursing services to grief counseling for your family. It's a comprehensive and compassionate benefit designed for the most difficult time in a person's life. And fourth, Part A covers some specific types of home health care. Again, the rules are strict. If you are considered homebound, meaning it's extremely difficult for you to leave your home, and you need skilled care to recover from an illness or injury, Part A can cover part-time nursing and therapy services, like physical or occupational therapy, right in your own home. It is not for personal care like help with bathing or for a 24-hour caregiver. It is, once again, for skilled medically necessary care on a temporary basis, a hospital stay, short-term rehab, hospice, and home health services. That's the list. It might sound pretty good on the surface. It might sound like you're covered for the big catastrophes. But we haven't talked about the cost, and that is where the real story begins. Okay, here is the part that gets everyone. This is the moment where the comforting idea of free healthcare shatters into a million pieces. Yes, it's true. 99% of people get Medicare Part A premium-free. You won't get a monthly bill for it in the mail because you already paid for it with your taxes. But this does not mean your hospital stay is free. It's not even close. The costs you face when you're sick, when you're vulnerable, are based on a confusing and dangerous concept called a benefit period. Now, your brain is probably trained to think in calendar years. Your old insurance from work likely had an annual deductible that you paid once a year. Medicare doesn't work that way. A benefit period is not a calendar year. It is a completely separate timer that starts the very day you are admitted to a hospital as an inpatient. That day, the clock starts ticking. The benefit period ends only when you have been out of the hospital or out of a skilled nursing facility for 60 consecutive days. 60 days in a row. Think about what that means. If you go home from the hospital but have a relapse and are readmitted 30 days later, you are still in the same benefit period. The clock didn't reset. And here's the most dangerous part. You can have multiple separate benefit periods all in a single calendar year. A hospital stay in January and another one in July could mean you have to pay the full painful entry price twice. So let's talk about that price. Let's break down the real costs of using your Part A coverage. For each new benefit period, before Medicare pays one single penny for your hospital stay, you will pay a large deductible. In 2025, that deductible is over $1,600. It's not a small copay. It's a huge upfront fee you have to pay just for walking through the door. And if you have that second hospital stay later in the year, you pay that $1,600 all over again. But it gets worse. That deductible only covers you for the first 60 days of your inpatient stay. What if you're really sick? What if you have a major surgery with complications? If your stay is longer than 60 days, you start paying a daily fee. The clock starts ticking and the meter starts running. For days 61 through 90, you will pay a coinsurance of over $400 per day. That's not a typo. Over $400 a day, coming directly out of your retirement savings, just to stay in your hospital room. It's a financial time bomb. And what about that skilled nursing facility care we talked about? The rehab you need after your hospital stay? The first 20 days are covered at 100%. That sounds good. But on day 21, the clock starts ticking again. For days 21 through 100, you will be responsible for a daily coinsurance of over $200 per day. And what happens after day 100? What if you're still not ready to go home? After day 100, you pay for everything. 100% of the cost is on you. Do the math. A long hospital stay, followed by a long rehab stay. This is how people face medical bills for $10,000, $20,000, even $50,000 or more. This is how a single health crisis can wipe out a lifetime of savings. The safety net you thought you had, the one you paid for your whole life, is full of massive, financially devastating holes. It was never designed to provide complete protection. It was designed as a foundation, and it leaves the most expensive risks resting squarely on your shoulders. So let's take a breath and pull all of this together. Let's recap what we've just uncovered, because understanding this is not just important, it's essential for your financial survival in retirement. So let's be crystal clear. Here is what you need to burn into your memory about Medicare Part A. First, Part A is your hospital insurance. It's the coverage you earned over a lifetime of work, paid for through your taxes. For this reason, you will likely not have a monthly premium. Second, it covers the facility, the room, the bed, the nursing staff. It does not cover the doctors who treat you inside that facility. That is a separate and very expensive part of the puzzle that we have yet to discuss. Third, and most critically, premium-free is not free, not by a long shot. You have a large, painful deductible for every single benefit period, not for the calendar year. This is a trap that has cost unsuspecting seniors thousands of dollars. And fourth, long hospital stays can lead to devastating daily costs. Part A is a safety net, but it is a net with massive holes. It was designed to protect you from the initial shock of a hospital bill, but it was never designed to protect you completely, especially not from a prolonged health crisis. Relying on Part A alone is one of the biggest gambles you can take with your retirement savings. Now, you might be feeling a little anxious right now. You might be thinking, this is more complicated and more dangerous than I ever imagined. And you're right. But knowing the truth is the first step to building a real wall of protection around your health and your finances. The system is designed to be confusing, but you do not have to be a victim. You now understand the foundation of Medicare. But what about the biggest missing piece? What about the doctor's bills, the checkups, the lab tests, and specialist visits? That is all covered by an entirely different part of Medicare. It's called Medicare Part B, and it comes with its own monthly premium, its own deductible, and its own set of rules and traps that you need to be aware of. To continue your journey to true understanding and financial security, your next step is to watch our video explaining Medicare Part B. It's the second pillar of your coverage, and you cannot afford to misunderstand it. If you found this information valuable, if it opened your eyes to the reality of how this system works, then do 3 simple things. First, subscribe to the Medicare Compass and click the notification bell. We are your independent guide, and we will make sure you are never caught by surprise again. Second, leave a comment below. Be honest. Did you know how the Part A deductible and benefit periods really worked? Your experience could help someone else in this community. And finally, share this video. Share it with a friend, a family member, a coworker who is also approaching this critical stage of life. The 5 minutes they spend watching this could save them from a costly and heartbreaking mistake down the road. Welcome to the Medicare Compass. Your journey to clarity starts now.